later. So I can
Yeah,
let
that's
these
a
guys
great question
take it
because
from there and
yeah, I
see
recall
where
I
we go.
recall specifically that we were when we went through all the analysis that we were expecting an increase, but it was supposed to be capped at 7 or 8%. Um, and I don't think that's the case. And I'm sorry, Ray, I haven't. I know you've been talking more with Dawn and Larry about this. So I haven't.
Not me. No, mainly Don
Oh,
Marcello.
mainly
But
Dawn.
anyway,
Okay, all right,
we'll
good.
catch up as it goes. So, all right, guys,
Yep. So
in
I'll,
your
I'll answer
hands.
that first question. So that rate cap did go into effect last November, right? So when we started, it wasn't going to be a full year. So they did give the rate cap. We did have that rate cap for the last renewal. And how we got here today is all PEOs renew based on claims. So there had to be something pretty major over the last year or so that was driving up claims.
And you guys don't have optics to what that is?
No, and this is the highest renewal I've ever seen. So that had to be a pretty massive increase. But what I'm also going to tell you is whatever it was can't be lingering any longer or much longer. Because normally, when we go out to quote, if this was an ongoing claim, we would never get a quote from anybody. So the fact that we have a couple that do look good tell me that claim is not ongoing. I reached out to Extensus. I don't have an answer yet as to why, but we have a few good quotes that are saving you a lot of money from
Now,
your.
could it have been a mistake on Excensus's side? The fact
No,
that the fact that it went away so quickly makes me wonder, how does a claim go away like that?
it might have been something. I don't know. It could be a Cobra person. It could have been someone who left the firm. It could have been someone who, God forbid, passed away. Again, you're small enough, you probably know a lot about everybody. It could be a dependent, but it wouldn't be like a surgery that's a big hit. This had to be something that was ongoing because they would never give an increase that big.
What was the
But
percentage increase?
84%.
Yeah, it sounds like a mistake or a bait and switch, to be quite honest with you. But it is what it is. It's not like we can negotiate with them and say, explain it to us, right?
Right. Even if they got it to a 40, we're not going to be happy at the end of the day.
No,
no,
absolutely not.
but
But
again, it's just so bizarre to me. I've never even, in all my years of having employees, never came anywhere near experiencing something like this. So what are you talking about? Like someone putting in, claims for drugs that are
It could,
Well,
necessary?
Larry, you've always been fully insured when you're on the, you've always been fully insured. That rate, when a fully insured rate in New York is community rated, it's just a pool, right? So regardless of your company's particular claims when you're fully insured, has no bearing on your renewal. Like the whole community gets that rate. When you go to like this, the PEO, they have that flexibility of charging you whatever rate, so they could look at your claims and come up with that determination. Again,
So is it a
unfortunately,
mistake to not to go on a PEO then?
no, because if you remember when we did compare the fully insured, if everybody went on a fully insured compared to the rates that we received from Extensus, it was a huge savings. So if we look at how much was saved over the last year, or it's going to be 15 months by one time renewal compared to what it would have been, it still was a financial savings for the firm. And all right, you can continue with that along that path.
right. So, listen, I'll say this. You have 18 people on benefits. You have a few that have dependents, but when you're paying an annual premium of $260,000 a year, all it takes is one really bad claim for the insurance company to lose money. And as much as no one wants to switch, including us, The good news is we got some alternatives that save you money. And, you know, when I share my screen in a couple of minutes, I'll kind of walk through the pros and the cons of each, because yes, no one wants to do something for a year or two. You should be in a PO for about 8 years with sustainable rates.
Well, if this is a chronic condition or a chronic disease, or, what's to say that, next year we're not going through the same thing? There has to be a sustainable solution, because, I get it. All insurance companies will take your money as long as you don't put in a claim. But the whole idea is that you should be able to put in a claim if you're paying them, right? So, and there has to be legally, there's got to be some cap, for them to come back and say, okay, you're 84% more, because I don't know, somebody's cat died. It's just, a little bit mind-boggling. And then the other question that I have is that, you guys touted Extensis as, the best solution. Does this now mean that we have to completely switch, including payroll and all the other PEO services that we're getting, or is it just switching the health insurance piece?
No, it's switching. Well, there's two options, right? I don't think to stay with Extensis and carve out the medical benefits back to the open market. I don't think financially it's going to make sense, but it's an option. If we go with one of the options I'll show you in a little bit, yes, you would have to switch everything from payroll to technology to service, and it is a complete change.
No,
But I want to just point out one thing about Extensis with the renewal. Well, I do think this is ridiculously high. Keep in mind, we have several hundred clients with Extensis. About 92% of all our renewals were single digits.
Yeah, Ari, I have to tell you, I really don't care about anybody else. I
Right. No,
really
I
don't.
know that,
I
Larry.
care about us. And I look at this and it just is so disturbing. And so again, and my concern also lies in, okay, so we make a switch and then the person that put in the claim last year all of a sudden arises again, puts in that claim again, and we're back where we started. So does it make sense to go to one of these open pool things just to protect us from this type of thing?
So as long as you can save, and again, that's going to be your decision at the end of the day. If you're looking at the financial impact, I would say you would want to make the change to another PEO, unless you're willing to absorb a bigger increase and move to the open market, and we can either stay with Extensis, get a separate payroll company that's cheaper, get workers' comp on our own. You have some options. The main thing for me was when we got this renewal, I happened to be with Ray that day, and we saw what that increase was. We got Dawn and Andrea worked very, very hard to get this out to market, so I never have to hand in this renewal to another PEO, because if another PEO saw that increase, it would be an automatic decline. And that's why we kind of rushed this whole thing to say there are some solutions. And the one I'm going to ultimately recommend from a long-term standpoint would be Insperity. And the reason being, they don't save you the most amount of money. They tend to have the best renewals in the industry. And even if that claim reoccurs and another person has a massive claim, you're never going to get an 80% increase. Mike, who's on my team, we used to work at Insperity years ago, right? Do they have high increases? Yeah. I've seen groups get 20% increases. No one wants a 20% either. But I'm going to say most of the groups are single digit because they buy their insurance differently than an Extensis.
So has anyone reached out to Extensis and said, this is historic as far as the amount of this increase. We need an explanation.
Yes, I've done that. I've had numerous calls with them on this. As of this morning, I reached out to them. I don't have a response yet because something's off to me the fact that we got quotes. So again, I'm not saying move tomorrow. I just want to give you your options so we can start weighing each of them. Because if this renewal does stick, which I have a feeling it will, I need to give you the options that doesn't crush you financially.
All right, let's go into what the options are. And then, I don't want to sound like a jerk, but, part of the reason why we went with extenses is because we were told they're awesome and they're only going to do probably 8% annual increases. So, we factored in, 8% increments moving forward. Hopefully that's not the case with Insperity or whoever else you're going to recommend.
Right. Now, again, and I can't go back a year and a half ago and remember every conversation, but I could tell you for all PEOs, 95% of their clients typically get single-digit increases. However, it's based on claims. And that's something that we can't control. That's where, like, let's just say you find out 2 years from now that someone has, God forbid, cancer, an autoimmune disease, liver issues. Let Ray, myself know very quickly because, again, we want to be strategic because the last thing we want to do is give you a 20% increase and have
Can
no
ex-
place to put you.
Can extenses share with us how much our claim was last year?
I'm pushing for it. Typically, they don't because of HIPAA. Because if they give you too much detail with 18 people on a benefit plan as a smaller organization, you can kind of sometimes narrow down who that person is. And from a compliance reason, they're afraid that if that person gets fired, it's a lawsuit. But we're pushing for it again.
But in order to justify an increase that's beyond the pale, they should be able to give us that information.
I agree with you, but I just know it's going to be very difficult to obtain. But we're pushing for it, and I'm hoping I get something for you. But my number one priority is I don't understand that 80-something% increase because I've done this a long time. Something doesn't add up to me.
Ideally, Larry, they're going to come back and say it was a mistake and it should only be whatever, right? That's the best case scenario. But in the event they don't,
Yeah, we need to have a plan B.
Right.
And, Insperity has different packages. So really, there were 4 PEOs that we've received. We could still receive more, but, we wanted to get in front of you as soon as possible once we saw some of these dollars that are coming in. So when you look at this, Insperity, Venture, Engage, and JustWorks are the ones that quoted. The reason I said Insperity, even though they're not the cheapest, I think that does give you your best chance at sustainable rates long term. But I'm going to take you through all these. I mean, I'll eliminate JustWorks. While they're saving you dollars, they're not saving you enough. But Insperity, Venture, and Engage all have pretty competitive medical. From an admin fee perspective, I got to do a little bit of work on that because the one piece that we didn't get when we did that screen share is what you're actually paying per employee per month. So I put it in red because that's roughly what you're paying, but I know it's not an exact number. So I'd rather be positive. But the medical is the biggest number I want to really focus on today. So you were paying, based on the 18 people, $260,000. Extensus one's 480. And then you look at Insperity, depending on the package, is anywhere from 250 to 296. And then Venture and Engage are both in the 246 range. Where I'm going to kind of say Engage could be dangerous, they renew 1/1. So I don't know if there's a rate cap or not to have, but when you look at their history, they're not as big as an Insperity or a Venture. So I do believe it's more risk long term on a bigger increase potentially. So let me start with Insperity because I really do think they have the most cost containment long term. And you have 3 plans currently. Can everyone see this okay?
Make it a little larger, please. Yeah,
How's that? Or you want it still larger?
that's great.
Okay. So you have 3 plans today, and I'll take you through all 3. Insperity in this specific package offers 4, and all 4 would be offered. So would you like me to start with the low plan, the high plan, so I know which order to go in?
I think, listen, I think if the plans are comparable, and there's also, this causes disruption to the employees, right? Because we switched from ADP, and Larry had his plan. We said this is the next best thing since sliced bread. The majority of the people hopefully were able to keep their doctors. You know, uh, I- the folks are looking. The employees are going to be looking to be able to keep their primary care and specialist physicians, and if for it not to cost more money out of their pocket. Um, you know, just looking at the chart, it looks, pretty straightforward and pretty even depending on the type of plan that we're going to provide. Um, now, if you could go back to the previous slide, that has the money out of pocket, where you're talking 260 versus 264 through 296 with Insperity. Is the slide that you were just showing tied into one of the 3 options, or
Yes. The one
which
I
one?
was just on was Premier, which gives you the least amount of savings. And the reason it gives you the least amount of savings is because of your high plan. That was the only package that had a high plan good enough. And I'll go through all of them.
That had what? I'm sorry, a high
A
what?
high plan, right? So when you look at the package I was showing you, you have your high plan, which has 6 people on it. You have a 30/50 copay, no in-network deductible. This is the only package that came close for that high plan. So when you look at apples to apples, it's the same. United Healthcare Choice Plus Network. So again, very large national carrier. Copay wise, it's the same. $30 for primary care, 50 for specialist. Today, your plan has no in-network deductible. This goes to 250. However, your plan today, after no deductible, you have a hospital copay of $500 a day up to 3 days. You have a $200 outpatient. With Insperity, after that 250, which is a calendar year, it's covered at 100% in network. So to me, I'd rather have a $250 deductible, knowing that everything after that outside the doctor's office is covered at 100%
And
versus
what
these copays.
and what about employee out of pocket?
So out of pocket is in row 9. Today it's 4,000. This goes down to 3,000. So the reason I went with the least savings first, it matched the high plan the best. And again, they have other packages
which we have a large population of our 18 people on the high
Right.
plan.
A third of your people are on the high. For the most part, your plans are split evenly amongst the 3.
So theoretically, it would be a detriment to them if we went to one of the lesser plans that we're talking a 30 grand difference over the course of the year to give people the same options that they have today, and hopefully their primaries and their specialists will be on the United Healthcare rosters.
Right. Now, again, if we decided, we're not deciding anything today, any of us. And we decided to have a little bit lesser of a plan that's still very, very strong, you could always adjust it with contributions
Contributions from whom?
from the
Employees.
employee. So
Yeah.
let's just say, for argument's sake, we could save $200 a single. Am I going to care if if you save me, let's say, $100 a month as an employee? Am I going to care if my copay goes up $5 or $10? No. I'd rather take the money in my pocket. But again, let me start with the best plans first, and then we could decide if it pays to look at some of the other plans that are not as rich. But for this high plan, your RX is better. For tier 2 drops 15, for tier 3 it drops 20. They have a tier 4, which is 120, which you don't have today. The one negative to this plan is you have an RX deductible for each person of $150 per calendar year, where you don't have one today. But generally speaking, comparable. I think most of the things are a little bit better for the employees.
It's
RX
also a
deductible,
PPO. It's also a
correct.
PPO.
So if someone does go out of network, you do have a $750 deductible, then they pay 30% to a 9,000 max. Today you have no coverage. But I want to preface the out of network, because when we say it to somebody, I don't want people really going out of network because they only get reimbursed on 110% of what Medicare allows. So being in the tri-state area, trust me, employees would get balance billed a lot. But when you look at the premiums for this plan, again, these are your renewal rates I have. I really should do it the current, but your renewals at 1872, this comes to 1136.
Wait, hold on, Ari.
Yep.
Is that based on the 87% increase, or is that
Yeah,
based on?
no, it
Is
is.
that
Let me fix this real quick because I want to change this. I want to show your current. Because these are your current rates, right? So today you're paying 1,015. Just continue with this. And this rate is 1136.
and that's our contribution?
No, that's total dollars. We'll have to go into contributions if this is the path we go down. But total dollars, right? It's more than your current. However, a lot less than your renewal.
Well, the renewal we're not even considering. So, we can't compare, celery to apples. It's got to be fruit. So, for you to say, "Oh, this is a great deal," because you're not going to get screwed as much, doesn't make any sense.
All right, but so yeah, all right, pull up the fully insured spreadsheets that I sent you, because
Yep.
what I did, Marcel and Larry, is I just put up a quote to try to find something similar plan design on the open market, just so you could see what those fully insured rates would be.
So on the open market, to stay in that specific plan with Anthem, those rates are $1,600 a single for a 2040 copay with a $500 hospital copay, no deductible, in network only. So that rate is $600 more than current. And if you went to United Healthcare, that rate is this one right here, 1477.
And how does that compare to what we're paying today? Not the crazy increase.
So the not crazy increase was
260,
1,015 you were paying.
right? But forget about the numbers, family.
The
What are
single
we?
rate.
Right, but what
260.
are we? We're paying total out of pocket 260K, right?
Correct.
And what does this cost out of total out of pocket?
Hold on. I have to
That
do
was
some quick math.
307, I think it said, or something. Yeah.
Hold
Well, that would be if everybody went on that plan. So
Yeah.
it would be less if you broke it down, 666, but
Right.
So stay with Blue Cross. Let me do that real quick.
And this is open market, meaning that we would do things a la carte.
that's right.
This
Then
would
we
be
would
the health
find a
insurance.
workers' comp and a payroll and a HR and
Right.
I'm just going to compare the high plan for the moment.
Yeah, that's all.
So just give
Compare
me 2
apples to apples.
seconds.
Yep.
Yep. So that's monthly. Let's do. So it's 15,000 a month times 12. So that's 190,000 for the 6 people on the high, compared to 126,000 that you're paying today.
Yeah, but that doesn't give us the total picture. So I need to know 260 versus what's the
Okay,
total
so
number
I'll
of?
do the rest. If you give me 2 seconds,
Yeah, of course.
I'll do quick math while we wait. So I'm just matching the plans. So that's the middle plan is right here. Let me just drag that. 409,000. So if you stayed with Anthem in the open market, not in a PEO, it's $409,000 based on the most apples to apples comparison
Yeah, so
versus 260.
yeah, so
versus
it's
260.
140,000 more.
Correct.
Yeah, I don't know if that's an option.
Right. So that's where we're looking for the next best option. And again, from a price perspective, it's not Insperity. From a better long-term cost containment, I would say Insperity is a good answer, especially, the middle plan, copays go up $10, deductible drops 500, the out-of-pocket drops 2,000. It's 10% instead of 20%. Not that that's a big deal. Prescription is marginally better. You still have an RX copay, which you don't have today. A much better out-of-network benefit, other than the reimbursement rate is lower. But it's a normalish increase for a medical trend. And then you have your HSA plan, which is a $1,600 deductible. That goes to $1,650. It's 10% instead of 20%. Out of pocket goes up 500, and RX is better because today you pay 20% after deductible.
Okay, Ari, I don't think we don't need to go through
Okay.
all these. We'll have to get to that point. So
Yep.
basically, what's our timing on having to figure this out?
So I'm gonna say sooner than later, because if any of these PEOs ask us for a copy of your renewal, they're gonna pull the quotes. So I would say we probably have a couple of weeks at most to at least say we're going to move forward and deal with a contract. Doesn't mean you have to implement it in a
Yeah.
week, right?
Can
The
you
other thing is,
speak?
I mean, I really need to understand from Extensus how they can justify an 80%. So is there someone we should reach out to personally that you guys is not getting back to you guys, or how do we get an answer here?
I'm dealing with the top of the food chain, but I would absolutely call your HR person at Extensus and destroy them. Right? I'm working it from an executive level, but I would absolutely go after the person who manages your account.
Okay.
Can I ask? It's related. What are the cost implications for the other services that we currently receive from Extensus, including the whole HR support piece, the workers' comp? One thing is to say, okay, we're going to pay $30,000 more for premium for the healthcare. What are the comparative costs associated with the rest of the services that Extensus provides?
So Insperity does charge more as a base admin, even though I still don't know what your exact number is on admin fees. Right? I'm waiting on that, but let's just say my number is kind of right. Might be a little bit higher, but it's definitely not lower from the Extensus side. It's a few dollars more, but nothing, in my opinion, that's earth shattering. The medical is the number that concerns me, because that's the number that inflates every year at the largest pace.
So overall, going to Insperity from where we are now, how much is our overall yearly increase?
Okay. On that specific package, $51,000, closer to 52.
So 52, of which 30, if you
Is
could
in the
scroll,
healthcare. Yeah.
if you could scroll up,
Yep.
so 260
40
to
of it is
296.
healthcare.
So of the 52, 36,000 is additional healthcare premium. Just looking at your comparison here, it looks like liability insurance goes up from 3 to 4.6. Where's the other 20 grand?
Life insurance, because you have 10,000 of a benefit, Insperity requires you to have 50,000, so it costs more. That's $4,000 in itself. It's the admin fees that are again higher, and again, I think you're paying more than 120. But I wanted to be conservative. I just need a copy of your invoice to justify some of these numbers. But you know, the healthcare to me is the biggest piece because that's the one, as you could see, was crushing.
Okay, so what I'm going to ask is, I think you need to do a finer analysis with our invoices, so that Larry and I know what the net increase is going to be, and if you could break it down, it doesn't have to be uh, as detailed as this consultant compliance, the whole thing. But if, it sounds like there's 5 or 6 buckets, it would be important to know what those buckets are, and for you to explain the 52 grand increase.
Absolutely, Marcel. We could absolutely do that. That's
All
not an
right.
issue.
Yeah, because
We just wanted to put something and rush it in front of you, knowing that that looming increase was large, and the fact that we had something. I didn't want to sit on it and get this thing 100% accurate.
Yeah, and listen, Insperity is, I had never heard of Extensis before, but I definitely have heard of Insperity, and have several friends who use it as a solution for their companies. I don't know if we looked at them originally when we switched over from ADP. It's neither here nor there, but it would be interesting if we did look at them, to pull out their old quotes and compare it to what we have, because it could give us a point of negotiation, if in fact that's even a possibility.
Yep. No, I mean, I could tell you Insperity wasn't competitive the last time. And, again, and again, these are my notes. We just changed our name, so I'm still struggling to find certain files. But one of the biggest things was with ADP, having that Anthem network was very important. And you were getting a big increase from ADP, which we're able to skirt and keep you with the same carrier. So it wouldn't shock me if this is part of the reason why some of your increase is a little larger. But again, they haven't given me any details, so I'm still pushing on that.
Okay. Larry, do you need any other info? I think we've got.
No, I think that's it for now. I mean, it's really so disturbing. I just love to know some facts. Like that is just egregious business. And it's, if you guys have never seen anything like it before, I can't imagine, I can't imagine how we can move forward without an explanation.
Yeah, I'm in agreement with you.
Before we end this call, Larry, Dawn had mentioned when I spoke to her last Friday that you have a couple of new employees that are being onboarded. Are they going to be on the health plan? Do you know?
Some of them for sure. Yeah.
So, Ari, do we go back to these companies with these new employees, or what do we do?
I
Over
would,
there.
Ray, I would not worry about that for
Okay.
right now because,
Okay.
they're all going to be uh, onboarded, but they're not going to have health insurance until, they've
Well,
been here for.
This is November 1st that we're looking
Okay,
at for this.
got it.
But I would probably not want to go back because I
Okay.
don't want to rock the boat. Right. The
Okay.
more questions I ask, the more changes I make, the more likely someone's going to ask me for a copy of that renewal, which I
Okay.
really don't want to do.
You
And then,
employees have a 3-month probationary period where they don't have
Health insurance. Yeah,
health insurance as
so they would be after November 1st then.
most likely. Yes. Yeah.
Okay. All right, real quick, if you could just quickly put up the middle level benefits, just approximately $16,000 less. Do you have those?
Okay, these.
Just the
You're talking
next
about the
level.
select. Yeah, from next
Right.
package,
Yeah,
correct?
yeah.
Okay. So right. So in this plan, the difference is, and this will maximize your savings a little more. The high plan has a $500 deductible where you
Two,
don't have one today. And you gonna
Right,
say
but
something, Ray?
on the plan right before it was 250 that you just showed, right?
Correct.
So this would be 500 instead of 250.
I'm sorry, you lost me now.
The the
Okay, so
benefits that you first showed for that 296 was a $250 deductible PPO. If you go to that,
hold on,
the
I'm
plan.
gonna put it on here so
Okay.
everyone can kind of see.
Marcel, I just want you guys to see when he had the two up the 260 to 296, there was also one that was 280. Just to get just an overview of what those benefits would look like compared to your current ones, which would give you more of a savings on your medical benefits.
Yeah, we'll have to dig into this, Ray, and just
Okay.
like, figure out what we want to do.
Okay. All right. So like
Okay.
for the PPO, like instead of a 250, it's a 500.
Right,
So it's not significant, 3,000 to 4,000, which is a very rich benefit
right.
for, just saying there's other ways to look at the
In the
overall
cap.
cost.
Yep.
Yeah.
Yeah, so I think just to tie a little bow on this, if you can, obviously you're recommending the PPO 500, which is the closest thing that we have to the top line benefit from expenses.
That would be
Uh,
the 250 would be, I'm not recommending anything. If
You
I'm
have
showing
right now,
some,
Marcel, you have an EPO, so in-network only with a $0 deductible. The most expensive Insperity grouping of plans, that $0 deductible would go to 250, but it would be no cost after that in the hospital, where
yeah,
today it's a $500 copay.
I think that's palatable. And it'll be easier to explain to the staff that's on this.
Okay.
And the hospital copay is $500 per day with a $1,500 max. So even though they have a $250 deductible, if they do have a hospital event, it's going to be less expensive for them.
That's right.
Okay. Yeah. So if you guys could provide that additional analysis and report back to Larry and I, and then we'll have to make a decision. And obviously, let's try to get some clarity from extenses because it does sound like a mistake.
Okay, guys. I think that, yeah,
All right.
that should wrap it up.
All right. So then we'll be back in touch as soon as we get some information or answers from Extensis.
All
Yeah,
right, guys.
just an FYI, Dawn is on a personal leave, rather sudden. So if you need anything, reach out to Larry and I, and Andrea will be able to get you copies of the invoices. If you reach out to Andrea directly, just copy Larry, Dawn, and myself, so that we're all on the same page. And Larry and I could jump in if Dawn is not available too.
absolutely.
All right,
Okay.
guys. Thank
All
you.
right. Thanks.
Larry, I'll call you on